absorption, and elimination. Okay? All of these things we've all covered before in levels 2. We got a little bit on the surface. We talked a little bit on the surface about some of these disease processes. We'll go in detail and we'll talk more about some other disease processes so you can kind of get an idea of it's just building on the information that you had prior to what you're getting today. So the unit objectives are quite clear, just as we always study for our exams. We want you to take all of the information, especially that is in red, and look at that and try to put it together in such a way that you understand how you're going to care for your patient, when you're going to contact your physician, and how you're going to educate your patient. That's what we're looking for right now. What are your priority actions? We always want to know, what are we going to do first to make sure that we're caring for our patient? So here we have a couple of medications that starts off on our PowerPoint that we have here with medications. It's a little bit different than how I've had it set up before in the past, so I want to try to put things in perspective. So don't get, too out of whack if I'm not kind of covering it exactly the way that it's listed on the PowerPoint. I want to cover it in such a way that I am putting it in order of your study and how I want you to study. So I sat down and went through all of the slides to see how they were set up. And then I came back and I said, well, let me put this in an outline so that I can have it set up for you for your studies, okay? So, on antacids, what we need to know about antacids. What do? Okay? They promote gastric mucosal defenses, right? They promote those things. They protect. That's what they do. When a patient is going to be taking antacids, we want to teach them some things. And the most important thing that we want to teach a patient who is taking an antacid is that they need to take it 1 or 2 hours after a meal, okay? So we want to remind them also that sometimes antacids can interfere with some other drugs. Those are some important points that we want to know about antacids. So what's a good thing to do when we have a patient who our GI doctor has ordered antacids for? We want to look at their medications and make sure that we know what kind of medications they're taking so that if we need to educate them on what's the best time to take that medication, we can do that, okay? So those are the things that are important as far as antacids are concerned. And then we move down to H2 receptor agonists. H2 receptor agonists. Such a big old long word just to say that I may order my patient Tagamet, Pepsid, Zantac. You can buy Zantac over the counter. You can buy Pepsid over the counter. But these are your H2 receptor agonists, okay? When a patient has been ordered to take these medicines, I want to make sure that they have no renal impairment already. They're not compromised renally. They're not compromised in their liver function. I want to assess for allergies. Another thing that some people may not know, especially if you have grandpapa or mama who wants you to go to the store and get them some medicine. They may not understand that patients who are elderly and confused may not need to take these kinds of meds. Okay? It's only going to make the situation worse. So if they are confused or if they are disoriented, we do not want to prescribe these types of meds to elderly patients. Remember, we talked about antacids and making sure that we look at their meds and know what they're taking. If the patient is taking an antacid and an H2 receptor antagonist, they need to take them 1 hour. Take those meds 1 hour before they take the antacid or 1 hour after. Another thing to make sure that they understand that it's better to take these meds at bedtime. Give them a chance to work. Let them work overnight. So those are the important points for your H2 receptor antagonists. Do I need to repeat something? Got it? Okay. Proton pump inhibitor. The definition is in the name. Proton pump inhibitor. Our stomach has a proton pump. They have all of those. If you've ever looked at any animation on how the stomach and how the gastric secretions and all of that work, it's kind of like a piston, like a engine. And how they have those pistons that go up and down and that kind of thing. That's what it reminds me of when I think about proton pump. So I'm going to give this medicine because I need to inhibit these proton pumps from making overproduction of secretions. So some types of medications that you may find that are called proton pump inhibitors are going to be omeprazole. I know y'all have probably given omeprazole plenty of times. Omeprazole. So I'm going to teach my patient who's taking omeprazole or some other proton pump inhibitor that they should take it 30 minutes before the meal. Take it 30 minutes before your meal. Another important thing to remember. Do not chew, crush, or open the capsule. It should be taken whole. That's very important. Very important. Emphasize to these patients on most instances, not all, but on most instances that this med may be taken short term. The doctor may not want you to take it for a long period of time, but that's in some instances, okay? That's not testable information. Some instances, I just wanted to say, that some people take it long term, some don't. Have the patient, again, very important that they need to take it whole. The proton pump inhibitor is activated by the presence of food, so the rationale for giving it ahead of the meal is that the drug needs a chance to work. It needs a chance to work before the patient eats. So that medication works in the presence of food. Okay. Prostaglandin analogs. Prostaglandin analogs. An example of a prostaglandin analog is what? Cytotec. Cytotec is an example of a prostaglandin analog. Okay. What it does is that it stimulates mucosal protection and decreases gastric acid secretions. Okay. So what I would teach my patient about this med is that when I'm taking Cytotec, I need to avoid magnesium-containing antacids. avoid those. Why? You might ask. I'm glad you asked. Because I don't want my patient to get diarrhea. Okay? If they take a magnesium-containing antacid with Cytotec, they may get diarrhea. Pregnant women should not take this med. Cytotec, in some instances, we've used it in our oncology department in the past. And so I'm definitely going to remember to educate, if the doctor's ordered this, I need to educate my pregnant mothers. I need to educate them because this drug can cause abortion. It can cause premature birth, or it can cause birth defects. So more than ever, I most definitely do not want to harm someone's baby. And I want to make sure that I know that my patient's not pregnant. Now, a lot of times, just like when you're going to get an x-ray or something, and some docs will order you to have a pregnancy test done, just to be on the safe side so they know that they're not harming the fetus. The next drug, you ready to move on? The next drug that I feel like is important to understand and talk about is going to be the mucosal barrier fortifiers. We see these a lot in the nursing homes for sure. Like the sulforaphate and the caraphates. We see those in the nursing home and on GI floors, of course. They are a protection. They remind me of something like a Pepto-Bismol type situation where they coat the stomach. So, what's important to know about carafate and sulforaphate and all of these different types of medications that are going to coat the stomach? Give them 1 hour before meals. Sometimes we can say 2. It's okay to say 2. Take them at bedtime. Sometimes it's better to take them at meals and at bedtime. So you'll see a lot of times the doctor will have it written for bedtime. That's a possibility. But the most important thing about this drug is knowing when to give it as opposed to other drugs or what time you want to give it. Okay? So, something that is very important to note about these drugs that protect the stomach. The reason why we say to give them before the meal or at bedtime, and at bedtime if it's scheduled for the ID, is because the food may interfere with its ability to grasp hold of the mucosa. We need that medication to have precedence over the food, and then we eat the food, if that is the case. Now, I know y'all probably say, Lord have mercy, how am I going to remember all these different times? And I got to do this and do that and do this. But do not give within 30 minutes of giving an antacid or other drugs. So if my doctor has ordered this med to go with my patient to bed, I've got to schedule it around or make sure it shows up on the MAR to be given in that 30-minute window as opposed to those other meds. Okay? So with those antacids, we don't want to do that because it could interfere with its effect. I think the last one, this is one that we are prokinetic drugs. Prokinetic drugs. Prokinetics are like your red glands and that kind of thing. GI motility, they stimulate. These drugs promote peristalsis. Okay, they promote peristalsis. When your gut has slowed down. We need it to start up again. So the doctor may order them to have Reglan. Okay. They don't use them too much today, but I've seen doctors, still order, some of your older GI doctors, to stimulate motility, they'll order Reglan. And that's that. That's it. That's all I need y'all to know about the drugs. The hepatitis A and B's, immunizations and such. Kind of want to put these over here on this end because we already know. We know that there is an immunization now for hepatitis A. There is one for hepatitis B. So we're familiar with that. We're okay with that. We can deal with that. There are 5 types of hepatitis. We've talked about them so many different times. They are drilled in our head. ABCs and 1, 2, ABCs of hepatitis. And then you have the ones that we really want to focus in on because we want to make sure, especially us that go out and eat a lot, that we're not picking up something that someone else is giving to us. So we certainly want to be careful about that. Hepatitis, we know that HEPA means liver. We talked about that, I believe, before. And, of course, the itis being the inflammation. So there we get hepatitis. It can be acute or chronic. We know that. We know also that hepatitis A and C, or hepatitis B and C, are the most common of the hepatitises. Less common types of hepatitis may be caused by, and some people don't know that some chemicals can cause hepatitis, some drugs. Sometimes if we have drugs that are hepatotoxic, that's what you're going to see when you go to look them up in your nursing references. It's going to say hepatotoxic. And then also some herbs. That's why it's a good idea to make sure that the patients know if they're taking any home medications when we do their admissions and interviews and such, that we ask them if they're taking any home medications, including herbal medications. So that way you can assess whether they may be hepatotoxic. So what we want to do is look at each one of these hepatitises and know that we need to know which ways we need to go in order to protect ourselves and how we need to, and what we need to look for in our patients who are having signs and symptoms. But what I want to do though is I want to go first and I want to look at hepatitis A. Hepatitis A, the causative agents, again, is just like an enterovirus, okay? Enterovirus, if you ever had the doctor to say that you have hand, foot, and mouth, or if your child has hand, foot, and mouth, it's similar. The enterovirus is similar to the same one that causes hand, foot, and mouth. So that's why it is so important for us to make sure, like with my little ones, they come flying out of the bathroom when they was little, and I know they didn't wash their hands. And I'm turning them right back around. Let's get right back to the bathroom and make sure that we are washing our hands so that we can stay, okay, stay healthy. The virus is hard to kill. So, hand washing for hepatitis A is the thing that we need to focus on most. We need to focus on hand washing. And the thing about it is with this virus being so hard to kill, the only thing that will destroy it is chlorine bleach or high temperature. So if you got a patient in the hospital and that patient is suffering from hepatitis A, I'm making sure that I'm probably going to double glove And I'm probably going to make sure that I talk to the family, talk to the patient, make sure that I am constantly scrubbing my hands and making sure that I'm not carrying this disease to other patients within the facility. And I'm quite sure there are some kind of bleach concoctions that they have in the hospital that would be able to kill this. Reason why I say that, because it does happen. I had a family member who was stationed over in Korea, South Korea actually, not too long ago. Ended up in the hospital and was in the hospital for 60 days with hepatitis A. He had been diagnosed with hepatitis A. How did he get it? Well, we know that in underdeveloped countries and places where water might not be clean like it needs to, that's one way. And when they went back and they traced it back, what he had done is he had bought some fruit, but he washed the fruit with the tap water. And that's how he ended up with the disease. Could not keep anything down, just constantly throwing up all the time. Had to have fluids and in the hospital for all that time. And so it's serious. And like I said, here we're fortunate, but what do we want to educate patients or people on who are traveling to these places?
Bring your water.
Don't drink the water. Don't drink the water. And if you got it, make sure you got bottled water. At least get you some bottled water. No ice. Some people think that just because, ice is the same thing, comes from the same place. So certainly do not use the ice as well. Okay? So sometimes there's an incubation period too. Like there's a 15 to 50 day incubation period. You may not even have any symptoms at all. And then all of a sudden, you begin to have all of this tiredness, the nausea, the muscle aches. It kind of feels like you may have the flu. And of course, you don't have an appetite because you're not able to keep anything down and you're too weak. And just like when you have the flu or pneumonia or something like that, you don't have an appetite, really. So basically, you're seeing the same thing with these people. So there again, the most important thing, the things that I want you to definitely take a hold of is to make sure that they wash their hands and make sure that we're educating our patients who will be traveling or has traveled, okay? The other thing too is if a person is set back by hepatitis A, and especially if they're an older person, we really need to be careful because remember all the hepatitises can have some insult to the liver. So we don't want them to develop hepatitis C or develop some kind of chronic liver disease because of their advanced age, because their bodies aren't able to encapsulate that illness and handle that illness like a younger person would. Okay? So we know that if they're older, it may be a whole lot more severe than it would be in a younger person. The thing that I hate the most about that, though, is that when I'm doing my interview or I'm talking to my patient and I'm getting that assessment done, they could present with other symptoms and we totally miss out on what could possibly be going on. So, especially like military or something like that, as in his case, we want to explore all the options. Okay. So, we're going to move on and talk about, all of them are basically the same hepatitis B, the HBV virus. And one of the reasons why we talk about hepatitis B is because we want to make sure that we protect you. We want you to know how to protect yourself. Okay? And therefore, that's one of the reasons why we focus so much on making sure that you have your Hep B series done before you come into the program. Because, you know, the risk of nurses being infected by hepatitis B is higher than any other group. So we need to make sure that we take care of ourselves, right? We need to be careful. So hepatitis B, it's a DNA, it's a strain of a double-sided particular blah, 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 surface antigen, all of these things that we need to look at and we need to definitely take care of. Let the people in the lab tell us, okay, we're good to go if we get a needle stick. If we know that that patient has some type of disease process, not only should we get tested at that time, but keep in mind, we need to come down the road months later and we need to be tested because symptoms may not show up and they may not be able to say that we're positive for some type of illness right away. So, what do we need to talk to our patients about? How do we need to care for them? What do we need to say to them? Okay, it's always the same: unprotected sexual intercourse with an infected person or infected partner. We need to be cautious of that. Please do not share needles. I don't want you sharing needles with your friend, not with your family. If you need some assistance purchasing insulin needles or whatever you need, please let us know. Okay? Don't even share razors. Don't share razors. Don't share toothbrushes. Some people are so in love that they will share their toothbrush. No, I'm not that in love with anybody. Not even my children. I ain't in love with my children that much that I'm going to share your toothbrush.
Nope.
Okay? My son tells me all the time, he'll drink something. Mama, here, taste. I'm like, okay, wait a minute. What you just said you had a sore throat the other day? Oh, Lord. And then I joke him about kissing on that girl. Anyway, yes, indeed. That's my boy. Practice safer sex. Okay? Practice safer sex. We need to get okay with these conversations and having these conversations. I keep saying it over and over again. We gotta have the conversation. We gotta, get away from the skirmish and we gotta talk. Never recap needles. Y'all have learned that from day one. Never recap. I always think about your safety. And when in doubt, who comes first? You. You come first because you have a family that you need to take care of as well. So if it's something that you are uncomfortable with, get some help, let someone know, find a better way to do it so that you are staying safe, okay? Make sure that you are disposing of blood products, any kind of bodily fluids or anything like that according to the hospital policy or your facility policy, and certainly however it's going to help you to keep yourself safe, okay? Not only do we want to talk to our patients about accidental needle sticks or talk to healthcare workers about this, we also want to talk about blood transfusions. There are a lot of us out there who are infected or may have had some type of virus. So we need to also understand that blood transfusions that have not been screened, typically it's before 1992, somewhere around in that time, because when they started screening, we may not want to do those blood transfusions, okay? And we also need to be careful with hemodialysis. Yes, we need to talk to them about open sores. We need to look at ourselves and inspect ourselves before we go to clinical or before we go to care for one of our patients. For us that's already working out there in the medical field, we need to, protect ourselves and cover our wounds, okay? The other thing, and the sad thing, is that we need to talk to moms. We need to talk to moms about their babies and birth and all of that, and the things that could happen as far as passing on from mother to baby. It can happen during birth. So we want to talk, we're going to have that conversation. Just to recap, how do we need to dispose of our needles? How do we need to talk to our patients about disposing of needles? Sometimes they don't have the proper equipment, or they don't have the boxes that they need. So we talk to them. I don't know if they still do this in the health department, but I know they used to tell them that a milk jug, they could get a milk jug and they could use that. Okay, they can use a milk jug as a way of disposing of needles. And then, of course, the needle exchange. The clinics will help with that. Yes, sir.
They recommend now either a 20 ounce or 2 liter because it's a thicker plastic.
There you go. Yeah. That's one way. Educate your patients. Let them know that.
And we'll tell, like you and our diabetics, we'll let them know.
Diabetics, that is exactly right. Another thing too, what if they're taking Lovenox? A lot of times when they come home from surgery, they go home and they have a 14-day run of Lovenox or something of that nature. Same difference. Just because they had surgery and all of this, there still could be some problems with hepatitis, so we need to do the same thing. We need to discuss the same things. Same thing as it is as health workers, same as it is for custodians, teachers, nurses, police officers. Police officers, they see a lot when they go out there. They have to take somebody down. They take them down, they scrub them on the ground, whatever. Hopefully they don't scrub them too hard, but sometimes it happens. And, you know, the person's fighting with them and everything, they could get infected. So never think about it, but it happens. So again, here's your teaching. The same thing that we've covered, we've talked about it. Those are important points, things that I wanted to highlight and let you know that these are some things that we want to talk to the patients about. And we want to be educated on as well. Okay? Okay, yeah, let's recap again. Hand washing. I know I say it all the time, but I cannot express how important it is. Hand washing. That's what I want you to take away from this. Make sure, if your patient is going to be going to the bathroom, you know, talk to them about going to the bathroom. Tell them, hey, if you get through using the bathroom, make sure that you wash your hands. And I know it might seem like it's elementary, but it's not. It is not elementary because people will forget and they need to be reminded. Okay?